Chapter 40 is talking about nursing care of patients with disorders of the endocrine pancreas. So it's talking about diabetes mellitus. Diabetes mellitus is a group of metabolic disease in which defects in insulin secretion or action results in elevated blood glucose, which is considered hyperglycemia. High blood sugar is hyperglycemia. When you look at the word glycemia, glycemia is nothing but another word for sugar, for glucose. Um, and it just talks about with diabetes mellitus, either an individual will have type 1 diabetes or type 2. Either they will have type 1 or type 2 diabetes. And it talks, this paragraph right here, diabetes is a serious disease that can cause complications such as blindness, kidney failure, heart attack, stroke, and cognitive decline. It is the leading cause of lower limb amputations in the United States. With good education and self-care, patients with diabetes can prevent or delay these complications and lead full productive lives. Nurses play a major role in helping patients learn to care for themselves effectively. And this is pretty much, this diagram is explaining how when we eat food or we drink it, we consume it fluids. It's explaining when we eat foods or we consume fluids. Typically, we eat the food, it's raising our blood sugar. Once it begins to raise our blood sugar, the beta cells of the pancreas begin to secrete insulin. And it's secreting insulin to bring our sugar levels down, to actually lower our sugar levels. So as our blood sugar rise, insulin is being secreted from the pancreas to lower the blood sugar level. And it also gives you some pertinent information, some differences with type 1 and type 2 diabetes, where it's telling you type 1 diabetes, the pancreas does not produce insulin. So with type 1 diabetes, off rip is telling you the individual pancreas do not produce insulin. And that's part of the reason why they consider type 1 diabetes insulin dependent diabetes, because the individual will always have to take insulin. They will always have to utilize insulin in order to lower their blood sugar. So an individual who have type 1 diabetes will need insulin for life. Unless, of course, they got some type of transplant, that type of thing, a pancreatic transplant. Also, with type 1 diabetes, they used to consider it juvenile diabetes because it was common in the younger population, in the adolescents, that type of thing. While type 2 diabetes, insulin production is reduced. So you still are able to produce some insulin to help lower the blood sugar, but it's reduced. And or cells are resistant to insulin, where the cells are not accepting to insulin. And what that's doing is still keeping an individual blood sugar level elevated. Less glucose enters the cells and more stays in the bloodstream. And this just shared the information I already shared with you all, where it's telling you type 1 is formerly called juvenile diabetes or insulin dependent diabetes, Only about 5% of people with diabetes have type 1. So the mass majority of individuals who are diabetics have type 2 diabetes. And with type 2 diabetes, African Americans, Mexican Americans are at higher risk for type 2 diabetes at a younger age. And a younger age being where it was kind of common for a lot of people to, African Americans, Mexican Americans, to get diabetes type 2 in their 40s and 50s, while Caucasian American is being diagnosed with diabetes while they're in their 60s, their 70s, that type of thing. So it's definitely an age variation. Nowadays, a lot of people are being diagnosed with type 2 diabetes at younger ages, in their early 30s, their late 20s. And part to blame is the obesity in the world. America is an obese country. We have a high obesity rate, and that's really among all races, the majority of all races, as far as Caucasians, Blacks, Mexicans, that type of thing. But some races are really small frame. When you think about the Asians, the Koreans, that type of thing, some of the Arabs are more so small frame. But type 2 diabetes, formerly called adult onset diabetes or non-insulin dependent diabetes. All right. And with type 2 diabetes, individual may require insulin, they may not. And type 2 diabetes actually can be, what word do I want to use to say cured, or you can have, it can be resolved. My grandmother was a type 2 diabetic, and with her being a type 2 diabetic, she was really religious. And part of what she would say, hey, I'm not going to claim that. God got me, that type of thing. So she lost a little bit of weight, changed the way that she was eating, and she didn't require taking insulin or the pill form medication to actually help lower her blood sugar. So her diabetes resolved itself. And it just gives you a comparison of type 1 and type 2 diabetes. And it's something good for you to actually review. And they tell you high blood glucose complications, where with these two different types of diabetes, high blood glucose complications, an individual who have high blood glucose with type 1 diabetes is at risk for ketoacidosis. They're at risk for ketoacidosis, where their body will start to produce ketones. And it talks about treatment for type 1 and type 2 diabetes, where you see diet is a contributing factor for good outcomes, and even the treatment, exercise, and it's heal you. Type 1, you have to have insulin to survive. No insulin, you will experience the complications, you will die. I knew a young girl who was a type 1 diabetic, and with even me like just knowing who she was, it was to the point like, I don't think she's gonna live long or whatever. And that was just even back when I was young, where I'm looking at her, I'm like, she'll be taking her insulin like that type of thing, and she end up dying or whatever. You have to maintain your blood sugar, or it places you at risk for complications. And sadly, it can place you at risk for death. And the thing about when y'all thinking about diabetes or whatever, or even your blood sugar, exercise is some things you need to think about with exercising, because when you exercising, you actually burning off some of your blood glucose. You kind of burning it off, to say, and it's lowering your sugar level or whatever. And the individual will have to know if they exercise, and hey, you want to monitor your blood sugar, because you don't want it to be to a point where you exercise and then it burn off your blood sugar to a point where you become hypoglycemic, where your blood sugar is too low. your blood sugar is too low, and now you experiencing complications of hypoglycemia. So it's really important when you have patients who like to exercise, who are diabetic, where you are educating them on consuming finger foods. Hey, take you some snacks with you. I know you like to run an hour a day. I know you like to do your Pilates, that type of thing. Make sure you have some snacks with you in case you realize your blood sugar is your blood sugar is being lowered, that type of thing, where you have some snacks to raise your blood sugar up. And it talks about type 2 diabetes in youth. And obesity is causing younger people to become type 2 diabetics. Obesity is actually causing younger people to become type 2 diabetics. Gestational diabetes, 10% of pregnant women become diabetic. So gestational diabetes is diabetes during pregnancy, and it's telling you 1 in 10 women will experience gestational diabetes, and typically after the pregnancy, it resolves. But typically, if you become a diabetic while you're pregnant, it's just kind of a message that eventually you will be a diabetic. That's typically the message. And even women who have, and you all will learn once you get the OB, who have 10-pound babies, where they, girl, my baby 10 pounds, my baby 11 pounds, that type of thing, you are at high risk for diabetes. You are at high risk for diabetes. That's nothing but a precursor for you becoming a diabetic. And it talks about pre-diabetes. Pre-diabetes refers to blood glucose levels that are above normal, but do not meet the criteria for diagnosing diabetes. The normal blood sugar level is 70 to 100. A blood sugar over 126, typically you're diabetic. But in a clinical setting, just to say if I went to the doctor today to check my blood sugar, it's 126. This is the first time ever that my blood sugar been 126. They're not going to diagnose me with diabetes just from that one blood glucose test. They typically do 3. Now, it's another test where they can diagnose me. But typically, if they just prick in my finger to check my blood glucose, today it's 126. It's not a diagnosis yet. They will probably say, we're going to tell you to come in 2 more times before we get a definite diagnosis of diabetes. But typically, 70 to 100 is the normal blood sugar. 100 to 125, you are pre-diabetic. You're working on becoming a diabetic. 126 or higher is diabetes. And typically, if your blood sugar between 101, 125, that type of thing, doctor can start you on non-insulin medication to help lower your blood sugar or to keep it within normal range. And it also talks about the hemoglobin A1C, HbA1c. Sorry, it talks about the hemoglobin HbA1c, and that is you can get an HG1 a hemoglobin A1c test, and with that particular test, it's checking your blood sugar for over the past 90 days. What was your blood sugar running for the last 90 days? That will be used for a definite diagnosis for diabetes. And it talks about the classic signs of diabetes. You all want to remember the 3 Ps. The 3 Ps are the classic signs of diabetes because NCLEX will test you all on this. In class, you're going to be tested on it. What are some of the signs and symptoms of diabetes? And if you remember the 3 Ps, polydipsia, polyuria, and polyphagia. And poly is a lot. That's what poly means. Poly is a lot. And polydipsia is excessive thirst. This individual is always thirsty. And them always being thirsty is a result of polyuria. And polyuria is excessive urination. When I look at polyuria, poly, I know that's excessive. Urea makes me think urine. And then polyphagia. This individual is always hungry. And the reason the individual typically is hungry, if you are eating foods high in sugar, you eating foods high in sugar, what is your pancreas doing? Your pancreas is about to start secreting that insulin to lower your sugar levels. To lower your sugar levels, and what do? That make you back hungry. I'm hungry again. That type of thing. So polydipsia, polyuria, and polyphagia are classic signs of diabetes. It also talks about ketones. Ketones is a sign of type 1 diabetes. And it tells you ketones is acid byproducts of fat breakdown. So individuals who like doing some strenuous exercise, that type of thing, they not eating or you starving yourself, that type of thing, your fatty cells begin to break down and release ketones. And it can release an awful lot of ketones where an individual is even urinating ketones, where the ketones can be tested in urine, but you have elevated ketones in the blood. And it tell you the ketones can build up in blood and urine of patients with type 1 diabetes or late in the course of type 2 diabetes can experience ketoacidosis. And this was talking about fasting blood glucose levels when you haven't ate much, that type of thing, which I explained to you all what the normal range is for the blood sugar. And these are different diagnostic tests. Different tests that they can utilize to actually diagnose an individual with diabetes. The fasted blood glucose level can be utilized. A random blood glucose test can be utilized. Oral glucose tolerance to see, can you tolerate a lot of sugar? What effect do they have on your body when we have you drink all of this sugar? It talks about the glycohemoglobin, another word for HbA1c, which measures the blood sugar for a 2 to 3 month period, typically a 3 month period. HbA1c is used to diagnose diabetes and also to monitor diabetes control. So as future nurses, your diabetic patients who are already diagnosed with diabetes, doctor may order this test every 3 months. And that's just the check to see, hey, we want to make sure your blood sugar is being controlled, because it's a way of figuring out if this individual blood sugar is really being controlled. So we want to run this test about every 3 months to see what are you running. And it tells you with the hemoglobin A1C, a normal HbA1c is less than 5.7%. An HbA1c of 6.5% or higher is diagnostic for diabetes. And a HbA1c between 5.7 and 6.5, you are pre-diabetic. Patients with diabetes are advised to keep their HbA1c below 7%. Once your HbA1c is going over 7%, we know you are at high risk for complications. So we need to talk about the fasting blood glucose and HbA1c. And this is like a correlation between HbA1c and the mean fasting blood glucose. Typically, an individual HbA1c who's 6%, their fasting blood glucose is 126. Individual who blood HbA1c is 7%, fasting blood glucose is about 154. Will somebody read prevention?
Okay. It is possible to prevent type 2 diabetes. Research studies have shown that patients who have prediabetes can prevent or delay the onset of diabetes with loss of 7% of body weight and physical activity for at least 150 minutes per week. American Diabetes Association use of the diabetes medication metformin can also help patients with prediabetes. Patients at risk should have their BG levels checked regularly. Research studies are ongoing to try and find ways to prevent type 1 diabetes once and
Hello? Hello, can you all hear me?
We can now. You went out for a minute.
still going in
Sorry.
and out.
So it talks about therapeutic measures. The only cure for diabetes is a pancreas or islet cell transplant. However, diabetes can be controlled. Treatment begins with diet and exercise. Insulin is added for patients with type 1 diabetes and for those with type 2 diabetes. Insulin or oral hypoglycemic medications is added as needed. Weight loss is essential for patients who have type 2 diabetes and are overweight or obese. Blood glucose monitoring and education are also important for good diabetes control. And we all hear terms pre-prandial, post-prandial. Anytime you hear pre mean before something, post mean after. Prandial is another term for meal. So this is before meal, post-prandial is after meal. In hypoglycemia, we know hypo is low glycemia, sugar, low blood sugar, will be anything below 70. Because we know the normal blood sugar range is 70 to 100. So hypoglycemia is below 70. Hyperglycemia is over 100. And it talks about nutrition therapy. What are carbs? What are carbs? What are carbs? What are carbohydrates?
Mr. Williams, I'm sorry, you still going in and out.
Oh, I'm sorry. Can you hear me now?
Yeah, you'll go away.
Okay. Can you hear me better?
Yes.
Okay. What are carbohydrates?
Would it be like starchy foods, rice, potatoes?
Yes, that will have carbs in it. Carbohydrates is another word for sugar. That's all it is to me. Nothing but another word for sugar. And what it's pointing out, carbohydrates contribute most to the blood glucose levels. So when people blood sugar is shooting up, it's because of the carbs, where individual needs to start looking at the carbs that they are consuming or whatever. Deal with diabetes to really prevent diabetes. You have to constantly monitor your blood sugar, but you have to switch up the way you eat, where you kind of have to eat consistent foods. You kind of have to be on a strict diet where you cannot switch up the way you eat if you plan to maintain or manage your blood sugar. What effect could exercise have on a diabetic patient?
Is it pretty much what you just said? Like if they diabetic, they should watch how much they exercise so drop too low?
Correct. Yeah, that's literally what I wanted you to say to make sure you heard what I said. Right here in this first paragraph, exercise. Will somebody read that paragraph?
You went out again.
Thank you. Will somebody read the paragraph that say exercise?
I'll read it. Exercise lowers blood glucose by reducing insulin resistance and improving insulin action in the muscles and liver. The effects can last up to 48 hours. Exercise also improves levels and circulations, which is important because diabetes increase risk of cardiovascular disease. Patients are instructed to engage in moderate exercise at least 150 minutes per week, spread over at least 3 days in a week. In addition, it is important to avoid prolonged sitting with light activity at least every 30 minutes. Resistance exercise also improves glycemic control, strength, and activities. Patients with complications of diabetes must be careful in their exercise choices. The HCP or persons with diabetes who take insulin or medications that increase insulin secretions should check their blood glucose before exercise, source of glucose when exercising in case the blood glucose drops too low. They should also be cautious about exercising at the time of the day when the blood is lower point, when
Thank you.
insulin or medication action is peaking. Okay, you're welcome.
Oh no, thank you. And make sure you all are clear where it talks about we should be exercising 150 minutes a week over a 3-day period, which we should be exercising 30 to 50 minutes a day, at least 3 days a week. Because y'all will see that on test questions, y'all will see that when you sit for NCLEX. How often should an individual be exercising? And we know about 150 minutes per week over a 3-day period. Um, something else I need to point out. In a sedentary lifestyle, we know a sedentary lifestyle can have a bad impact on all of us. In a sedentary lifestyle is where you're just sitting around doing nothing. That type of thing. You're just sitting around doing nothing. And that's why, or kind of like a couch potato, just to say, if I had a twin brother and we both eat the exact same food every day, but one of us, we like to go outside, we want to garden, we want to cut the grass, that type of thing, constantly moving around. And the other one is living a sedentary lifestyle. Who is at risk for becoming obese? Which one will be at risk for becoming obese? The one where we eat the exact same foods, but you have one individual who is highly active. You have another individual who live in a sedentary lifestyle where they're not able to burn calories. That individual is at high risk for obesity. And it talks about medication. With insulin can be given sub-Q or by IV, or it can be inhaled. What do sub-Q mean? So sub-Q is in the fatty tissues. It can be given in the fatty tissues. Okay. With the fatty tissues, what do I want to say? Where are the fatty tissue at? If you give your patient their insulin, you know you have to give it in fatty tissue. What locations of the body is where we can actually administer the insulin?
Stomach,
Your stomach or like the upper
the
part
back
of
of
your
the
arm.
arm.
Yeah, your thigh, that type of thing.
Yeah.
Um, what was I going to point out? But the best place to give insulin is always in the abdomen. the abdominal area. When you are giving it, you never want to give it too close to the navel or whatever, but you want to give it in the fatty area, and you don't want to always give it in the same spot. Where every day I'm going to give it to you in your left lower quadrant in that one little spot where you got this patient abdomen extra tender, that type of thing. You want to switch up the different locations where you are giving insulin. What else? And when you are giving insulin, administering insulin, you want to peach that area and get them the shot. But of course, you clean it with alcohol before you administer the insulin. Clean it with alcohol, peach the area, and give them the shot. And for people who like really want to maintain a certain weight, carb counting is important, but not just carb counting, really calorie counting is really important. And at one point when I was in the nutrition course, I felt like I had the best body in the world, that type of thing, where I really had to be on a strict diet. And with me being on a strict diet, I was constantly counting my calories, but it also made a lot of people feel like I was acting funny towards them, because it was to the point that I stopped eating other people cooking. I only ate what I cooked or whatever because I was able to count the calories. Because a lot of times you go eat in somebody else's house, you never know what they cooking. You don't know what type of milk they're using. Some milk is higher in calories. Y'all like that red top milk, the whole milk? That milk is high in calories. That milk is high in animal fat. That type of thing. So when you like counting calories, you need to know everything that you eat. Everything that you eat. You all need to start reading nutritional facts if you aren't already reading them to kind of develop an understanding of what's high in calories. Because I've been around people, I don't know why I'm fat. I don't even be eating like that. That type of thing. Well, maybe you don't eat like that. Maybe it's what you eat. Because I see you eating the honey bun every morning. And even with honey buns, well, we know that can be anywhere from 300 to 500 calories for one honey bun. And the more calories we consume, the more we at risk for picking up weight, where you eat a honey bun every morning, but your peer is eating an apple every morning. Your honey bun is anywhere from 300 to 500 calories, while that apple is 70 calories. Who's at risk for picking up more weight? The honey bun eater. That type of thing. And it just tells you cultural considerations. African Americans, Hispanics, and Latinos, American Indians, Pacific Islanders, and Asian Americans are more at risk for type 2 diabetes than whites. And sometimes so a lot of who we are is based off the households that we were raised in. Even when you think about religion, you know, African Americans, when it comes to religion, chances are we Christian or we Baptist. Caucasian American, you know, due to the household they were raised in, chances are they Roman Catholic. You know, you get some Caucasians who are Christian, but the vast majority, they Roman Catholic. You think about the Arabs, where they Muslim. You know, depending on the house that we wake up in or that we're born in, it dictates a lot of our choices. And it talks about, it also points out with giving insulin, when you are giving insulin injections, make sure that if you gave it insulin injection this morning in the left lower quadrant, and you got to give some more insulin before the patient have lunch or something. If you decide to give it in the left lower quadrant again, you need to give it 2 inches away from where you initially gave it. And it talks about insulin pumps. Insulin pumps is equipment that would deliver insulin sub-Q. And this is a diagram of areas that you actually can give insulin. These are the fatty areas, you know, the back of the arm, that fatty area, the abdomen, the thigh, the buttocks. In some patients, you will kind of decide it's best to always give insulin in the abdomen. But some patients, you know, you might feel like it's best to give it to her arm or her thigh. Because I think I had one patient where she swing and punch, that type of thing, and I used to have to give her insulin and her thigh a lot because she likes to swing, punch, and kick you, that type of thing. So you kind of got to figure out where it's best to give patients. And of course, we do promote preference, where you don't want to just pull up a patient gown and go to try to stick them in their stomach, where you want to ask, hey, I'm about to administer your insulin. Do you have a preference on where your insulin you want to administer? You know, and some patients, give it to me in my arm, that type of thing. But you also want to educate them the best site for absorption of insulin is the abdomen. So the abdomen is the best site to actually administer insulin. And right here it's talking about different types of insulin. And this is what you all will be administering as future nurses. These medications, so you need to understand these medications. It talks about the onset of insulin, insulin peaking, and the duration of insulin. And the onset is, hey, how long when I give you this injection is it gonna take to work? How long before it start kicking in? So the onset is how long it takes for it to start kicking in. Peak is when is it going to be most effective? Or when is it really going to show some results? That type of thing. Where is it going to actually peak? And the duration, how long do this last in the body? How long will it last in the body? Very short-acting insulin works really fast to lower your blood sugar. And that's why they consider it best practice to actually give this insulin when the patient tray is in front of them. That way, if this is a short-acting insulin, it works short and it works fast to bring your blood sugar down. We want food in front of you. So if you get to feeling like you hypoglycemic or your blood sugar is too low, that you can eat some of your food to raise your blood sugar up. Insulin Lispro, Humalog, Novolog, these are short-acting insulins with short onset times. How long do it take for it to start working? Insulin Lispro take 5 to 15 minutes to start working. Humalog, 10 to 20 minutes. Novolog take 15 minutes. So with these short-acting, you want to kind of think it takes 10 to 20 minutes for this to kick in. Where do it peak? And when it peaks, meaning, hey, this is the time where it will probably lower your blood sugar the most. And when insulin Lispro, it peaks between 30 and 90 minutes. How long will this medication last in your system? 5 hours. Short-acting insulin, it's kind of like a rapid-acting insulin as well, but it's not as quick as the very short-acting. And the short-acting insulin is Humulin R or Novolin R, where the onset is 30 minutes. It takes 30 minutes for it to begin working, 2 to 5 hours to peak, and 5 to 8 hours it will be in your system. And it tell you with these two, when to give not more than 15 minutes before a meal. Not more than 15 minutes before a meal. And then you have the intermediate acting. take a little longer to kick in and peak than the very short and short acting. You also have the basal acting. This is considered the long acting insulin. And the long acting insulin is insulin glargine, which is Lantus. You will hear Lantus most, Lantus and Levemir. They are long acting insulins. That means that they kind of work for a long period of time. With these insulins, to tell you a long acting insulin, these insulins, we normally give it to a patient at night. It takes 1 or 2 hours for it to start kicking in. And it don't have a peak, but it kind of work to try to stabilize the individual blood sugar, and the duration is 24 hours. And you should be giving it at the same time each day. Long-acting insulin should be given at night. And you all will be tested on this box. So you want to make sure you have that box down pat. And it talks about it talks about sliding scale insulin. And the sliding scale insulin will be like, just to say, today you're my nurse, you check my blood sugar, it's 201. You will see an order for that patient where it's saying if the patient blood sugar is between 0 and 199, do not administer insulin. If the patient blood sugar between 201 or 200 and 250, administer 2 units of insulin. Patient blood sugar between 251 and 300, administer 4 units. Patient blood sugar between 300, 350, administer 10. Anything over 400, notify the healthcare provider. So that's what a sliding scale insulin will consist of, where the nurse is checking the blood sugar and looking at the sliding scale to see if it's appropriate or not to actually administer insulin. And there are some insulins that you may actually have to mix. And nowadays it becoming already mixed if it has to be mixed, but there are some insulins that you will have to mix. It talks about oral hypoglycemic medications. Oral hypoglycemic agents are not insulin pills. So with the pills that patients are diabetic patients or pre-diabetic patients are receiving, the pills are not insulin. It's not insulin, but they do work to lower your blood sugar. So oral hypoglycemic agents are not insulin pills, but they work to produce more insulin. They work to produce more insulin. Many oral hypoglycemic agents depend on at least a partially functioning pancreas. They are not useful for patients with type 1 diabetes. Type 1 diabetes will not receive oral hypoglycemic medications. Okay. Will somebody read Natural Remedies?
Many herbs and others have been promoted for diabetes treatment. Some patients have tried cinnamon for blood sugar control, but there's no scientific evidence that it is effective. If your patient wishes to try a natural remedy, to encourage a conversation with his or her healthcare provider first.
Mr. Williams?
Mr. Wood.
Hello?
Yes, I'm sorry. Here I come. I apologize. Yeah, sorry. And then with natural remedies, why is it important, or why do we need to always know the meds, the herbs, and over-the-counter medication patients are on?
Because it can have an effect on the medication. Sometimes it make it ineffective, or it can enhance what the medication is already doing, or
Definitely. Yeah.
make someone have an adverse.
Yeah. And it's just the medications for type 2 diabetes listed under this table. The metformin is a common one. A common medication is given to diabetics and pre-diabetic patients. And it actually said may enhance weight loss. I know a lot of patients, I had patients who quit taking metformin because they like it's giving them diarrhea. And one of the things right here that stick out with these medications, the sulfonylureas, is saying teach patient to avoid alcohol. So question, which type of diabetes can be prevented with exercise?
Type 2.
Type 2.
Yeah. The type 1, it can be controlled. It helps control it. They give you a summary of diabetes. And it's talking about acute complications of diabetes. We know hyperglycemia is a complication of diabetes. It can be caused by food. Hyperglycemia can be caused by stress. And what is stress? Something that made me upset, something that's working my nerves. That is stress. It also can be caused by infection.
Excuse me, Mr. Wynn, can you?
Huh? Did I
Can
go
you
out?
put your screen back down a little bit so I can see?
You want me to go up? Like
Right
that?
there, thank you.
You're welcome. But high blood sugar can be the result of food. When we eating food that's raising our blood sugar, stress. You went in for a surgery that caused stress on the body, is raising your blood sugar, as well as infection. You have an infection, it can raise your blood sugar as well. So y'all will see stuff like that where an easier test question, hey, what can raise your blood sugar? The first thing we're gonna think is food, that type of thing. But you also need to accept that stress can raise blood sugar as well as an infection. And it talks about morning hyperglycemia. Um, it talks about the dawn phenomenon, which leads to morning hyperglycemia. Sometimes patients experience elevated morning blood glucose levels, even though they have not eaten all night. Dawn phenomenon is caused by normal hormone fluctuation during the night, as well as release of stored glucose, leading to morning hyperglycemia. The Samaji effect occurs when the blood glucose drops too low during the night due to a missed snack or too much insulin. The body responds by releasing counter-regulatory hormones, epinephrine, glucagon, corticosteroids, growth hormones, which then cause rebound hyperglycemia in the morning. So you see, like epinephrine is produced in our body, glucagon, corticosteroid, growth hormones. All of those hormones can actually raise our blood sugar. So if you see test questions, which hormones can raise your blood sugar, you definitely know epinephrine, glucagon, corticosteroids, and quartz. Anytime y'all hear the word quartz in a word, you know it's a steroid. Anytime you hear steroid in a word, you know it's a steroid. So quartz is steroid, steroid is steroid. Y'all know people who are on steroids, sometimes being on steroids will raise your blood sugar and where you are a drug-induced diabetic. A drug-induced diabetic. This individual is a diabetic due to the fact that the drug that they are on is causing their blood sugar to rise or raise. It talks about hypoglycemia. What is hypoglycemia? Give me a number that would represent hypoglycemia.
Anything under
Like
70.
under 70.
Okay. Low blood glucose or hypoglycemia occurs when there is not enough glucose available in relation to circulating insulin. Skipping a meal can cause hypoglycemia. Exercising more than usual can cause hypoglycemia. Administering too much insulin can cause hypoglycemia. Repeated or extremely low blood glucose levels can cause neurologic damage because there's not enough glucose for the brain to function. Okay. And it's talking about hypoglycemia. When a patient is hypoglycemic, the nurse has to do something about it. And truthfully, as a nurse, what you all have to accept, if anything ever go wrong with your patient, you have to do something about it. Anything ever go wrong with your patient, you have to do something about it. With hypoglycemia, if your patient is hypoglycemic, you need to do something to raise their blood sugar. And if your patient is not NPO and your patient is not unconscious, you want to actually give them 15 grams of fast-acting sugar. You want to get them a simple sugar and a complex sugar. So if your patient blood sugar is 65, they're not unconscious, and the patient is not NPO, you want to get that patient a cup of orange juice. That's going to be the 15 grams of sugar, and maybe peanut butter and crackers. That will be a complex sugar to help maintain their blood sugar. The orange juice is going to raise their blood sugar up fast. That complex sugar is going to help to stabilize their blood sugar. And even after you do that, you need to recheck their blood glucose in 15 minutes and re-administer a carb if it's to a point that is still low. And for your patients who are unconscious or who are NPO, you may have to give them a glucagon shot, an intramuscular shot of sugar to actually raise their blood sugar. It'll tell you right here to treat hypoglycemia, administer a fast sugar, 15 to 20 grams of carbohydrates that will enter the bloodstream quickly. Examples of fast sugar include orange juice, diet soda, 8-ounce milk, raisins, glucose tablets or gel, lifesavers. What is dextrose? What is IV dextrose? So anytime you hear the word "ose" at the end of a word, you want to think sugar. Fructose, glucose, lactose, dextrose. You want to think sugar. So again, when you are dealing with patients who are NPO or who are unconscious, we need to give them, we need to actually give them IV dextrose, or again, give them sub-Q glucagon. I said IM, for some reason I thought glucagon can be given IM, but it's sub-Q. Whatever your book say, it's sub-Q glucagon, or we will give them IV dextrose. And do you need to report this to the physician if your patient is hypoglycemic? Hello?
Yes.
You need to report it to the physician. You also need to report it to the physician. You need to report it to the patient guardian if they have a guardian. The guardian needs to know what's going on as well. And it's just talking about diabetic ketoacidosis. It more commonly occur in type 1 diabetes, but not so much type 2. And again, diabetic ketoacidosis is the result of fatty cells releasing ketones. And the fatty cells typically release ketones as a result of starvation or strenuous exercise, that type of thing. As the ketones build up in the blood, ketoacidosis occurs. And when ketoacidosis occurs, the body attempts to compensate for acidosis by deepening respirations to blow off excess carbon dioxide. So initially, it's a metabolic issue that results into respiratory acidosis. Patient is experiencing metabolic acidosis while the fatty cells are breaking down and releasing ketones into the bloodstream, which will be a metabolic issue. And due to it being high ketone levels, it began to actually affect the respiratory system, resulting in respiratory acidosis. And the individual who is experiencing diabetic ketoacidosis, you may actually see Kussmaul respirations. And Kussmaul respirations is a deep sigh respiratory pattern. And a lot of your patients who are diabetics, who have really high blood sugar, sometimes if you smell their breath, it smells sweet. Their breath will smell sweet. But diabetic ketoacidosis, it can be deadly. It can send a patient to the hospital. And of course, it can result in Kussmaul respirations. And with diabetic ketoacidosis, treatment will be to give the patient insulin, IV insulin, or sub-Q, that type of thing. And ketones can be seen in the urine. You know, it can be in the urine. And it talks about hyperosmolar hyperglycemic state. And with this, the blood sugar rise and cause polyuria, which results in dehydration and a blood sugar over 1,500. And no ketones are present in hyperosmolar hyperglycemic state. Again, blood sugar rise and cause polyuria, which results in dehydration. And typically, individual will need IV fluids and insulin. It's talking about long-term complications of diabetes. Most of the complications involve either the large blood vessels in the body or the tiny blood vessels, such as those in the eyes or kidneys. Individuals with type 2 diabetes who maintain the HbA1c below 7% can significantly significantly reduce complications. Because once your HbA1c is over 7%, you are at risk for complications. It's talking about the macrovascular complications that's affecting some of the bigger systems or whatever. These problems lead to a higher incidence of stroke, heart attack, and poor circulation in the feet and the legs. So macrovascular complications are complications of the circulatory system, and where they're talking about it leads to poor circulation in feet and legs. That's where a lot of the diabetic patients barely can feel their feet. I barely can feel my feet because of the neural effect, where they barely can feel their feet, so they lose a sensation in their feet where you can barely feel. But you can still walk, but I barely can feel my feet. So that means if I'm walking barefoot and I have no sensation and I step on a piece of glass, I don't even know I stepped on glass because I barely can feel my feet. That type of thing. So it's imperative as nurses that we are educating our diabetic patients. You need to be looking at your feet every day. You need to get a mirror and you need to look at your feet every day. And especially when they're telling you, nurse, it's starting to feel like I don't get no sensation on my feet, or I barely can feel my feet. That type of thing, you need to educate them. You want to educate those patients about looking at their feet every day or whatever, because sometimes if you lose your sensation, you just stepped on a piece of glass, it may be a whole hour before you realize it's a piece of glass in my feet, and I've been dragging blood along for a while. I've been bleeding for a while. That type of thing. A lot of times that is a result that results in this patient having to get amputated. Because once they get open, a diabetic like have open areas, that type of thing, sometimes it's harder for it to heal. It's harder for it to heal. And gangrene set up, and the patient end up becoming an amputee. It talks about the microvascular complications. Microvascular is some of the smaller vascular systems where it affects the eyes. Some diabetics become blind. It affects the kidneys. Nephropathy is caused by damage to the tiny blood vessels in the kidneys. Diabetes is the leading cause of end-stage renal disease in the US. Talks about nerve complications, neuropathy. And notice this say nephro. Nephro is referring to the kidneys. This say neuro. Neuro is referring to the nerves. Neuropathy, damage to nerves as a result of chronic hyperglycemia, can cause numbness and pain in extremities, erectile dysfunction. A lot of men who are diabetic experience erectile dysfunction. His penis don't work no more, that type of thing. Men who end up being hypertensive, where they on certain hypertensive medications, it stops his penis from working. Not able to maintain a heart. What did I need to point out? And even with patients who have some type of nerve pain, the way that that's why it's important to ask patients, hey, you have some pain. How do that pain feel? Where they like, ooh, nurse, it feel like pins and needles. It feel like pins and needles. That's a sign of nerve pain. And typically with nerve pain, physician may prescribe gabapentin. They may prescribe Lyrica to actually help with that nerve pain. And it's it right here. Anticonvulsant agents, gabapentin, and Lyrica help reduce painful nerve impulses. And these are considered narcotics. At one point, gabapentin wasn't a narcotic, but recently they made gabapentin a narcotic. So this talks about infection. Persons with diabetes are prone to infection for several reasons. If injury occurs, healing may be slow because of impaired circulation. There may not be enough blood supply. to heal the wound or fight an infection. Talks about foot complications. What is this the result of? Foot complications, the result of this is having no feeling in the feet. Again, we just talked about that, where they start losing their sensation or their feeling in the feet. And it gives some foot care tips. Wash and dry feet every day. Use warm water to avoid burns. Apply lotion that does not contain alcohol. Avoid putting lotion in between the toes. Inspect feet for sores or red areas daily, or ask a family member to assist. Report any abnormalities immediately. Wear leather shoes and white or light colored cotton socks. Never go barefoot. Avoid garters and tight socks. Avoid crossing legs. You need to cut your toenails, not in a corner. Diabetic patients need to be careful with who they let cut their toenails, so a person will cut it wrong and they end up having an open area. See a podiatrist for calluses or problems with toenails. Have feet checked at least once a year, preferably 3 to 4 times a year for loss of sensation. Diabetic patients should be checking their feet daily. They should be checking their feet daily. Then it talks about special considerations for patients undergoing surgery. You just need to be clear. Surgery increases blood glucose due to the release of counter-regulatory hormones. What's the difference between subjective data and objective data?
Subjective is and objective is what you observe.
Yeah, subjective is what the patients say, and objective is what you observe, more so factual. And when you are dealing with diabetic patients, just to say you're dealing with a man, he barely can care for himself. You know, he got a wife. You should educate him and his wife right on diabetes. You should educate them both. All the education is required, because if you're working in a clinic and your patient is newly diagnosed with diabetes, this is a moment where you have to educate as a nurse. You have to educate as a nurse as far as, hey, this is what diabetes is. This is what it's doing inside your body. You know, this is how you prevent diabetes. This is the treatment that you will require. Hey, you have to give yourself insulin. These are the areas of the body that you can actually administer this insulin. Hey, you need to hold your skin like this when you actually giving yourself the insulin. Make sure that you are giving insulin in different areas of the body. That type, you have to educate that patient as well as their care team, the people who will actually help provide care. If that's the wife, that's the kids, they need to be part of the education as well. Okay.